Good morning, friends from all over the globe. It's day 2 of our Study-A-Thon. We've used 25% of our time, and I'm going to give you a brief update on what happened in the first day of our study, with a little bit of a summary of everything that we have been doing. And I am delighted to announce that we have one of our colleagues from Asia who will be explaining progress in the eastern part of the world. Unfortunately, we are fighting an enemy here that travels and disseminates very fast. This is a slide that Patrick Ryan presented only 8 hours ago, where you can see there were 526,000 cases and 23,700 deaths, only 8 hours after I've just looked at this website. And unfortunately, we have accumulated 6,000 more cases and 300 more deaths. I am aware, and I am sad to announce that nothing we will do in these 4 days will change this very rapidly. But as we discussed yesterday, we have the intention and the ambition to make and create reliable evidence that will help us facilitate the flattening of the curve by characterizing and identifying subjects who will need further attention, and also by helping the community of people who are doing randomized controlled trials and other types of research to identify the target therapies that they should be investigating. Although there are more challenges, and you know that there are more studies going on, there are 4 main tasks going on. One is phenotyping, creating phenotypes for the studies that we will be conducting. Another one is characterization studies. A third one is prediction, and a fourth one is estimation. I'm going to give you an update on each of these 4, and then I will get you to talk to our colleagues in Korea. Phenotyping, the team led by Patrick has been making great progress, and they set out a very ambitious plan of literature reviews, developing and evaluating phenotypes, generating study packages, executing them across the network, and then reviewing and disseminating their findings. They are looking at the phenotypes that we'll need creating for all these studies that you see on the screen, and they are making great progress, and we are seeing how they have allocated different tasks to different people and how these are progressing over time. And I'm sure we'll have an opportunity to see how this picture moves again tonight. In characterization, this is being led by Ed Byrne, and there have been intensive discussions and brainstorming activity in their channels. I'm delighted to report that there is now a main characterization protocol that has progressed very nicely, and I'm hoping that will be finalized very early today. And there's a new spin-out study and a new team being set up to look at people who, despite being COVID positive, are not admitted to hospital. So this will be the characterization of who is infected with the virus, despite not necessarily having a great deal of symptoms or not necessarily needing medical attention. In prediction, I was involved in a number of discussions yesterday. We started with 3 research questions under consideration, and there are at least 2 that are being prioritized and moving very swiftly to the next steps. A tool for the triage of subjects at high risk of pneumonia or poor outcomes amongst people who have just been diagnosed as flu cases, and this, of course, will be transported when data is available to COVID-19 cases. And then a second tool, which is for the identification of hospitalized cases that are likely to need intensive care. Finally, when it comes to estimation, we are looking at the safety of target medicines in the community using retrospective data. Of course, safety is of paramount importance here, and some of the treatments that are being trialed have some safety data, but not as much as one would need. And we are going to be conducting a number of studies to look at the safety of these medicines using retrospective data, and I'm hoping that this will be ready for Sunday. We are also trying to plan an analysis of antiviral efficacy amongst COVID-19 patients when data is available, and the plan here is to have readily available packages by Sunday, so that the minute we have data available on this topic on COVID-19 infectees, these analyses can be run in that data. Again, we set out very ambitious deadlines. I was joking yesterday that this is the kind of Gantt chart that one usually does for a 3-year project, and we're doing it for 4 days, including protocol writing, background section, and preparing a template manuscript, creating analytical packages and running them, reviewing diagnostics from the analysis and agreeing on the final set of analysis if anything else is needed, creating or modifying the protocol so that it's fully specified and fully detailed by early Sunday, and then consolidating and interpreting findings and disseminating them by the end of Sunday. I'm delighted to say that we had a very good exercise looking at the kind of skills that were needed to do all this. You can see that to the right-hand side in yellow, and the different tasks needed, and we believe that we have, with the team that we've been allocated, people who can do all these things. And I'm very grateful for the people involved in the IL-6 study, where I am seeing great progress and where I can see people contributing to protocol writing and background sections of the papers. And we will move on today to start discussing analysis. So in the first day, we did indeed complete most of the protocol writing. It will be just a matter of finalizing the little detail this morning. We started writing some background section and preparing a template manuscript where we will be adding the methods today and hopefully the results in the coming day or two. And we started preparing the analytical packages that will be shared with the colleagues who will run this across the network. I'm not gonna take the time to go through all the different channels because I want to give the opportunity to Chan to explain progress in Korea. But I really invite you all to take 10 minutes this morning to go through all the different channels that have been set up and check the activity ongoing. There's been a lot of work in the literature review team led by Nigel Hughes and Jenny Lane, where people have been creating great resources, collating all the literature available on on a number of different topics. Phenotype, as I mentioned, study execution and study package development have been making great progress. And I really invite you to go there, have a look at the channel and see what activity is going on. And if you feel like you have to contribute, you should do that and get in touch with the colleagues there. There are 5 ongoing studies on estimation. 2 of them, hepatitis C and HIV, are going to be merging into one, whilst characterization is going to split into 2 groups, one looking at the most severe end of the spectrum and one looking at the COVID infectees that don't have many symptoms. And then prediction and the rest of channels, I'd really say it would be good for you to have a look and see how much activity there's going on in there, and I'm really thankful for that. So in the next 8 hours, before we have the next catch up and global kind of huddle in what it is an early afternoon here in the UK, we should be ready to announce that we have finalized the study protocols, that the new study on characterization has already started and has an allocated team of people who will be working on it. I'm hoping to report that the colleagues from the prediction team will have started training their initial models. And then when it comes to estimation, I'm again hoping that we will be ready to share analytical packages to be created and launched across the network sometime today. Now, the big news from these last hours, while some of us were sleeping, come from the east of the planet, and I'm going to pass the word on to my colleague Chan from South Korea.
Okay, thank you for introducing. So we've just launched the open data for COVID-19 in Korea with the help of from the Ministry of Health and Welfare and HERA in Korea. So you can go to the website covid19data.hera.org.kr. And so this is as Daniel said, we do have the crisis of the COVID-19 in the world, and in Korea we do have the national claim system, which can collect all the data of the Korean patients, and our government decided to open this data set in distributed research network. So this is the agreement of the data set. So if you need, if you want to use this data set, you need to agree with these terms. So this data provides the comprehensive data, past history data from 2015 to 2020 of the suspected COVID-19 patients. So, and this all data that are de-identified and shared in the form of here as one data format or OMOP-CDM, which we can use. And raw data will not be available for download nor transmission, and researchers should upload their data research project to the dedicated website covid19data.hira.org.kr, and we will deliver the analyzed result values. The caveat is that you need to submit the documents demonstrating approval or exemption of the study from IRB review for export or publication of these results. But I'm currently discussing about this with our government. So currently you can execute the analysis, but you cannot export the data or the result before the approval from the IRB. So that's one caveat, and I'm trying to fix this. Okay, thank you for your cooperation, and I'd like to briefly introduce how you can use this website. So first of all, you need to sign up. So there is a registration button, and you can register by agreeing signing up, and log in. After login, you can change your profile and you can create a new project. So it's really simple. So you can just click the new project button, and then you can set the names of the project, or you can write the description of the project, and you can choose which data set you want to use. So we provide two different data set, which is here as one data format or OMOP-CDM format, and you can choose which statistical software you want to use, R versus SAS, and you can upload your software package. And if you want to change the analytic software package, or if you want to change the description of the study, you can edit them. All of these projects will be reviewed by the HIRA and us, and then we will execute this in the HIRA's data center. Thank you. If you have any question, please let me know by using chat room or by using general room. That's it. Thanks.
Thank you, Chan. I think we can still take questions here. If people want to write any questions, you have a kind of a little question mark icon on your screens where you can ask Chan or myself any questions. We can give you a couple of minutes for this.
Yep. So if you have any question, please let me know. Okay.
I'll give you 30 seconds if anyone has any question for Chan or myself. I can see there are some people have announced where the COVID-19 EMR CDM is available in the website, and there's also an alternative URL for HIRA COVID-19 CDM you can read. Okay, if there are no more questions, we'll leave it there. We'll see you again in 8 hours, less than 8 hours, and I'm hoping, as I said, that there will be a lot of progress with the different streams that we are running. Thank you very much, everyone.
Thank you.